Hi, my name is Dr. Mark Lowry. I'm with Advanced Otolaryngology and Audiology in Fort Collins, Colorado. We've been taking care of the ear, nose, and throat problems in our patients now for the last 23 years. There's a really interesting study that just came out looking at the 4 things that were most important to ENT patients. I was really surprised when I saw that the least important one was bedside manner. The 3 that were actually most important were cost, followed by professional experience, and lastly by wait times. And that makes perfect sense to me because in the last few years, with the high deductible health plans, we've seen patients become more and more responsible for the cost of their own health care. It's been very important from us from the very beginning that we established this practice to be very conscientious with the use of patients' time, but also their money. We tried very hard on our very first clinic visit to spend the time to get the most accurate diagnosis possible, and then only use testing to confirm a diagnosis and most of the time that's when we can't figure out what their problem is. We try to use generic drugs as much as possible because they're less expensive than brand name medications. And lastly, when we have procedures that need to be done, we try as often as possible to do them here in the office to avoid the expensive anesthesia and facility fees often associated with the hospital or a surgical facility. When we do have to do a surgical procedure on a patient, we really try as often as possible to use one of our local surgery centers. When we've compared costs, it turns out that the surgery center is about 1/3 the expense of the hospital. And therefore, we really are trying to keep your costs down as much as we possibly can. We also try to be very conscientious with wait times because we also know that our patients' time is very, very valuable. We want to thank our patients that have trusted us while we've been here to take care of their ear, nose, and throat needs, and we look forward to doing that in the future, continuing to contribute very high quality care in a most cost-efficient way possible. Thank you.